Hello, ladies and gentlemen. Welcome to Best Life Health Show. We are here once again to talk about a very important aspect of healthcare, which is obstetrics and gynecology. So, we are talking about obstetric and gynecology myth today. Um, by my right, we have a very distinguished, a very important guest today, who is a consultant in obstetrics and gynecology by name Dr. Jackson.
Thank you.
You're
Good
welcome,
afternoon.
sir.
Yes.
You're welcome, sir, to this show.
Thank
So,
you.
sir, it's a very straightforward one. We are here to debunk myth that affects our health. So, we are looking at obstetrics and gynecology myth there. So, but before we start, sir, I would like to know who is an obstetrician, who is a gynecologist.
Okay. Thank you so much, my brother and also. Once again, thank you for inviting me
You're welcome,
to
sir.
come share a few thoughts about my specialty. So, an obstetrician is that professional who manages a pregnant woman with all concerns about her pregnancy, while a gynecologist is that specialist who manages the reproductive aspect of a woman's health, meaning her womb, her fallopian tube, her vagina, her cervix, everything about her reproductive organ and all problems that could be related to it. That specialist is a gynecologist.
Gynecologist. So, do we have people who are obstetricians and then gynecologists, or they are always together, obstetricians and gynecologists?
Well, for now, you hear the word OBGYN.
Okay,
OBGYN, that's just obstetrics gynecology. They
gynecologist.
go together, but of course, in the global perspective, people subspecialize even under this complex units brought together.
Okay.
People still subspecialize, but for now, globally, it's just one faculty, one department.
Obstetrics
Yes,
and
obstetrics and
gynecology.
gynecology.
Oh, thank you, sir. Thank you for that. And I believe our viewers, at least, they have learned the difference between obstetrics and gynecology. Without wasting much of our time, let's go into the myths we have for today. So, the first question on our list today is
Okay, so the first, after the explanation of what obstetrics and gynecology is, the first question is actually about infertility. So it says, what is the real cause of infertility?
interesting.
Okay. Well, it takes two to make a baby. Okay, so when we discuss infertility, we are talking about inability of a couple to achieve pregnancy after 1 year
Okay.
of regular unprotected intercourse. That means at least in a week, 5 times in a week. And if 5 times is not 5 times in a day, 5 times across, 3 to 5 times across 7 days. Okay, so from that, you understand that when you talk of infertility, it's not the business of the woman alone.
Okay.
We have that problem in our African setting where the man goes and sleeps and says it is the woman's problem. Even the man's family people also think, imagine you married a man. Sometimes it could be the man's problem. In other words, there is no singular cause of infertility. Infertility could be as a result of a problem from the man, could be as a result of a problem from the woman. It could be as a result of a problem from both of them.
Okay.
The other perspective is that it may be unexplained or unknown. A couple is just unable to achieve pregnancy.
Everything
Not
is
because
everything
there is
is
a problem,
fine.
yes.
Okay.
For some inexplicable reasons.
Okay.
Okay. For some of them, they spontaneously achieve pregnancy along the line. We encourage them until a point where we feel it's time maybe they seek assisted reproductive techniques. But apart from that, so it could be a male factor thing. The man may not be making enough viable sperm cells. By viable, I mean healthy sperm cells. Okay. The woman is more complex for the woman. Okay. From the neck of the womb to the inside lining of where the baby will come and lie to the tubes where the egg and the sperm cell will fertilize and the ovary. Okay. So when we talk about infertility and we are relating to the woman, we talk about anovulatory factors, okay? We talk about tubal factors. We even talk about cervical factors, okay? So there's no one cause. And that is why I encourage women, if you have concerns about inability to conceive, come to the hospital. See a gynecologist. Be properly evaluated. Don't just sit down and say, oh, they say it's the man's problem. They say it's the woman's problem. Before you know, you get old. And the older a woman becomes, the more difficult for her to get pregnant. So, yes, infertility is not just a cause. There are causes and subject to evaluation to identify and treat. Thank you.
And I think some we also attribute the infertility to maybe a supernatural or they just attach it to superstitious,
Yes,
belief.
yes.
They see it from that superstitious angle.
Yes.
That maybe someone in the village or
My
somewhere
family, we've
is holding them back.
never given birth in my family, my grandmother, my mother. And the question is, how were you born? The issues here are enormous. But as medical practitioners, we don't dwell on the myths. We don't dwell on the traditional beliefs. We don't even dwell on the spiritual aspect. We want to look for medical causes.
Scientific reasons.
Yes. And discuss and see how we can help the patients. And a lot of those patients have been helped. And all those myths debunked. And they got to know that, look, I was just, being ignorant. That's all.
Oh, that's a wonderful one. Thank you, sir. So